Welcome back. When it comes to COVID-19, there is a race gap, with Blacks and other people of color disproportionately affected. Recently, the Centers for Disease Control in the U.S. found that 33% of people who've been hospitalized with the virus are African American, yet they represent only 13% of the American population. In cities like New Orleans and Chicago, the vast majority of fatalities have been African Americans. Is it because they're more likely to be affected by other risk factors like diabetes and obesity? Is it because they have less access to health care and are more likely to work in settings where they're exposed to infection? Or is there a genetic component? Here in Canada, we don't even keep statistics relating to race. I'd like to bring in Ralston King, a city councillor in the Ottawa area who has long called for public health data to be made available to better serve marginalized citizens. Ralston, welcome, and why is this so important?
Thank you. It's really important because we are in the middle of a pandemic, as we know. This is an unprecedented public health crisis, which really requires data. I mean, in order for us to make informed decisions about how the public healthcare system should function and how services should be delivered, we have to have high quality disaggregated data about the people who are being affected and the people who need treatment. And so in the United States, as you had referenced, we do know that there has been challenges based on data in certain metropolitan areas like New York City and Chicago around a disproportionate number of Black Americans, African Americans having challenges with COVID-19, especially since they have a lot of pre-existing conditions that can create challenges if you obtain this respiratory illness. So it's absolutely important for us to have data. I mean, they have data, they're collecting that. It's important for us to have that data in order to make quality decisions.